I am Ted Malinski. I am Distinguished Professor of Biomedical Sciences at Ohio University, Athens. I just presented a talk on the International Academy of Cardiology, our annual scientific session held here in Vancouver. The title of my presentation was to study the mechanism of the interaction of contrast molecules used in angiography. This is a paradox between necessity of use this kind of contrast agent in angiography to get an image of the cardiovascular system. However, the molecules which are used as a contrast can be cytotoxic for the cardiovascular system. And this problem can be pretty severe when we have when we apply this contrast media for the treatment of the cardiovasculature, and in the same time in angiography, and at the same time we have already existing disease like, for example, hypertension, atherosclerosis, or we have a high content of sugar, means that we have a situation which make cardiovascular system, especially endothelial cells in the cardiovascular system, dysfunctional. And under this kind of condition, we may have a very severe situation because this contrast will make very adversary effect on dysfunctional already endothelium, and especially endothelial cells which are present in kidney, and very often these agents used as in angiography can make a severe problem in the kidney dysfunction, and also they may have the patients may require dialysis, and about 80% of people admitted with this kind of side effects, they would not survive. Before we use a nanomedical technology to study the processes of the interaction of these contrast molecules with endothelial cells in the cardiovascular and the renal system. We develop a special small nanosensors about 200, 300 nanometer in diameter, which can be placed close to the surface of the endothelial cells and measure concentration of the two crucial molecules involved in the endothelial function and dysfunction. Which one is a nitric oxide, which is a cytoprotective molecule and vasorelaxant, and peroxynitrite, which is a molecule of the probably highest oxidative power, damaging usually for the vascular system. With this kind of tools, which are about 700 to 800 times smaller than the single human hair, we were able in real time to see the interaction of this special contrast molecules with endothelium. And appear that after collision of these molecules with endothelium try to repel this molecule from the surface. Of course, by the design, this molecule, they have to be adsorbed on the surface, meaning that we have this contradiction here. And we see it that the collision of this contrast molecule with endothelium will stimulate nitric oxide release. and it is okay. However, after prolonged stimulation of nitric oxide release by this agent, we observe that the peroxynitrite, this oxidative molecule, start to be released by endothelium in very, very high concentration. And after a few hours, this concentration usually is much higher than the concentration of protective nitric oxide. And system, the endothelium, as well as the nitric oxide synthase with the release nitric oxide and also superoxide, which later react with NO2, with nitric oxide to produce peroxynitrite, they become uncoupled and dysfunctional and create or stimulate a cascade of events leading to the production of very many different molecules in the vasculature, including inducible nitric oxide as well as adhesive molecules, and of course it will molecules which contribute to inflammation. Therefore, we study with this nanomedical system the fundamental event which leads to the dysfunction of endothelium by the contrast media, and it was the first stage. And second, we study the influence of the potentially useful molecules which can restore dysfunctional endothelium, dysfunctional because of the presence of dyes. Therefore, we use a different treatment with statins and with L-arginine, which is substrate for nitric oxide synthase. We use a different antioxidants, and we find that we can correct or restore partially at least a function of endothelium, which is of course become dysfunctional because of absorption of this contrast molecules. And it is important finding because now we can, in the situation when we will have when we predict that we will have some complication due to use of dye for the angiography, we can pre-treat the patients or we can prepare the patients for this kind of event by supplying some additional protective molecules to the cardiovascular system. We cannot eliminate the adversary effect of this contrast media totally, but at least we can mollify significantly influence of the adversary influence of the contrast media on the cardiovascular system. Therefore, we can minimize the damage done to the cardiovascular system, especially damage which can be done by this contrast media to the renal system, which is a major problem in angiography.